Hello, everyone, and welcome to this new episode in our series, Question and Answer. Dr. Mustafa here, and in this episode, we will have a medical emergency question, and then we will explain the different options, and we will also provide the reference for the answer. The medical emergencies in the dental office is a very important reference that's listed in the NDEB list of references, which is also known as Malamate as well. So it's a very important book. And our question for today, we will provide the answer for that from Malamate, from the medical emergencies in the dental office. If you are interested in knowing more about some of the topics that usually come up in the Assessment of Fundamental Knowledge exam, the AFK, subscribe to just have the notification for the new videos that we will keep posting. And let's see our question for today. So our question for today says, all the following information is true regarding Semi-Fowler position, except. Always when you read the question, try to mark that you will see actually 4 options. 3 of them are correct, and 1 of them is the false statement. So they are saying that all of the following information is true except 1. Always read the question very carefully. Option A, the patient is seated in an upright 45 degrees. So in relation to Semi-Fowler position, this is option A. So is the patient would be seated in an upright position, which is 45 degrees, or no? Option B, it slightly decreases the intracerebral blood pressure. Option C, it is recommended for a patient with transient ischemic attacks, which is TIA, with elevated blood pressure. Last option, option D, it is not recommended for suspected stroke victim. So those are the 4 options in relation to Semi-Fowler position, and we want to have the 1 wrong statement in those 4 options. So the first option is the degree of positioning the patient in a Semi-Fowler position. Is it 45 degrees or no? The second option is related to the blood pressure, the intracerebral blood pressure, and if it is true that Semi-Fowler position reduces the intracerebral blood pressure or no. The third option is, and the fourth option, it's related to if it's recommended for transient ischemic attacks or suspected stroke victim. Because based on this, if you know the information about that, you will be able to identify whether C and D are true or false. So let's see the reference. Let's see what Malamate said in the reference. So this is first of all just a picture to demonstrate the Semi-Fowler position. So this is Semi-Fowler position, which is actually recommended for suspected stroke victim, which just answered our questions, right? But we will go back and read all about the other 3 options and see from the reference how they are actually true. So this is Semi-Fowler position, and as you can also see that the angulation is probably going to be 45 degrees. It's almost upright position, but it's not an upright position. So let's read here. So those screenshots are from Malamate, from the section of managing the TIA and CVA, which is the transient ischemic attack and the cerebrovascular accident victims. So here, as we can see, let's bring the highlighter. So for most TIA and CVA victims, they usually, most of them, they remain conscious throughout the episode. The patient should be allowed to remain seated upright. So this is the position that we are looking for, which is 45 degrees or Semi-Fowler position being recommended. So the most recommended actually position for patients that are conscious and they are suspected to have transient ischemic attack or cerebrovascular accident, it is actually Semi-Fowler position, which is 45 degrees. So that means our first option is actually true, right? Moving on, this is an attempt should be made to maintain the patient's comfort. The Semi-Fowler position, so this is another important information about Semi-Fowler position, that slightly actually decreases the intracerebral blood pressure, this is a very important information, whereas the supine position increases actually the flow to the brain, right? Because when you have the patient in a supine position, the blood goes right to the head and basically it increases the intracerebral blood flow. A potentially dangerous situation during a time of significantly elevated blood pressure. So this also answers our third option, which was also true, that especially with the transient ischemic attack patients, when they are actually having an elevated blood pressure. So this section here talks about conscious patient. However, even for an unconscious patient who are actually having their blood pressure markedly elevated, so for when the unconscious patient's blood pressure is markedly elevated, the position should be, so this is very important, like we're talking here about not all the unconscious patients. There is an exception here that the blood pressure is significantly high. The position should be altered slightly from normally recommended supine position for unconscious patients. So usually for unconscious patients, to try and manage the airway and the ventilation, we usually have the patients in supine position. However, if we have a blood pressure that's markedly elevated and the patient is unconscious, we can still try to actually readjust or reposition the patient a little bit to a different position. So because of the increase in the cerebral blood flow in the supine position and the markedly elevated blood pressure observed in what is likely a hemorrhagic CVA, so that's usually happen when we have a hemorrhagic cerebrovascular accident, the blood actually pressure and the cerebral blood pressure gets very high, the patient should be placed in a Semi-Fowler position. So this is very important. When you have a hemorrhagic CVA, even if the patient is unconscious, or when you have an unconscious patient and the blood pressure is high, you go with the Semi-Fowler position instead of the supine position. And so there is one exception. So this new position, they said that here in this line, this new position must still allow for the maintenance of two things, of the patient's airway and ventilation, right? So if necessary. So we always have to keep in mind that even if we are going with the Semi-Fowler position, we are still able to maintain the airway and ventilation. There is one case, continuing here, if cardiac arrest actually ensues and cardiopulmonary resuscitation becomes necessary, the patient then must be repositioned into a supine position. So even if the blood pressure is high or whatever, when we have a cardiac arrest, usually the heart is stopped. So at this point, we take the patient back to the supine position and we elevate actually their feet. So based on those information that we just have read in those screenshots from Malamate from medical emergencies in the dental office, we reached to the conclusion that our answer is going to be the exception, which is D. It is actually recommended for suspected stroke victim. And all the other options are also true. So the patient is seated in an upright 45 degrees. It slightly decreases the intracerebral blood pressure. So that's even the reason for us to take the patient from a supine position to a Semi-Fowler position when we have a high blood pressure. because we want to actually decrease the intracerebral blood pressure. Option C is also 100% true because as we read now, we use it for the transient ischemic attacks and when we have an elevated blood pressure. So that leaves us with the wrong answer, which is D, because we use semi-Fowler position for suspected stroke victim. So that's it for our episode for today. If you, as we said, if you would really like to just see more videos about the question and answer series, and we will have more topics, we will talk even more about some of the medical emergencies. It is a very important topic, and it is actually coming up in the exam. It's a very important section in the assessment of fundamental knowledge. So try to always read about all the different positions that you position the patients in all the medical emergencies. And it's a very important topic and the medications as well that are used for the different emergencies. We will see you in the next video. Thank you so much for watching.